Yes, I'm not a spokesman for the State Education Department. I don't pretend to be. But what I understand the commissioner to say, and what I think I agree with him on, is that if you find yourself in a hole, do you try to climb out of the hole sooner or later? And sooner probably makes more sense. And that's what we're looking at here, that is it going to be an ongoing process where everybody in the state learns more and implements more completely next year and the year after and the year after? Absolutely. But if we recognize that we've got too many kids graduating from high school who aren't where we need them to be, we can't afford to wait, because those kids are there now. And that, at least, is the argument, though I certainly recognize compelling arguments on all sides of that. Let me switch gears very quickly to the career and technical education side of what I think is going on, not only statewide, but we can look at in our region some very positive trends. We know that around the state, students have opportunities to attend career and technical education centers in all of the 37 BOCES and in all of the big 5 school districts with the 5 big cities in the New York City. There's CTE of varying shapes and sizes around the state. What I want to speak about is what our CTE programming looks like here, so that you can get a sense of how robust the career and technical educational opportunities are for students to prepare them for college and careers. In most of the state, the percentage of high school juniors and seniors who attend career and technical education is somewhere slightly below 20%. We're at 44% this year in St. Lawrence Lewis BOCES, meaning 44% of all the juniors and seniors in the 18 component school districts of this region spend half of their day in one of our 3 technical centers in one of our programs. That's, I think, for many folks, a great surprise. We already have a huge percentage of our kids attending a regional high school program for all intents and purposes. And that is, we're very proud of that, and they're getting, we believe, very, very high-quality instruction, and I'll talk with you a little bit about some of those programs. But what that means is we are already taking maximum advantage of that opportunity that I think some other parts of the state may not be. It's over 1,000 students at any given time in any given year. And that I want to speak in a moment, too, about the college credits that they're earning, or opportunities for college credits. They're not just earning high school credit there in those programs, and that they leave these programs college and career ready. So if you look at our programs, many people in their mind have a vision of career and technical education, CTE, that is sort of the traditional, what we call big door programs. You've got your auto technology, your metalworking or welding, HVAC, building trades. These are robust programs that continue, and we're very proud of them. They're great programs. But if that's all you know about CTE, that's one small slice. We've got a little something for everybody in career and technical education, because CTE it prepares some students for jobs right out of high school, and that's a wonderful thing, good paying jobs in many cases. But it also prepares a nice percentage of our students to go on to 2-year and 4-year institutions, because we have some other programs that for instance, computer and business technician, culinary arts, environmental technology, early childhood education, health careers, electronics. These are programs, certainly, some of which will prepare students to go right into the workforce, some of which prepare students for further education. But we also have some programs that are designed for the valedictorian and salutatorian of their respective high schools. Some of the most rigorous academic programs around. Our allied health program, for instance, gives students a sense and an experience in various aspects of the health careers field. They get to see what it's like to be a doctor, a nurse, an x-ray technician. Very, very rigorous in the expectation for students. The science and math in there is at a very high level. It tends to be students who are at the top of their classes who sign up for this program. We also have a pre-engineering program, which if subscriptions rather are adequate, will run on any given year. Not currently running this year, but we would love to see that running again. Again, a program that'll prepare a kid to be able to go to a Clarkson or an RPI or an RIT or a WPI or other rigorous institution and pick right up where they left off. Our criminal justice program is another example. Kids who may want to go on and become law enforcement officers or corrections officers, or who may want to go into law school. But we're talking about high expectations, high rigor. We're very proud, too, of a new program that not only shows an opportunity for students and an example of rigor, but also a partnership with the private sector. Several months ago, Kinney Drugs approached us. And this is one of the best things I think that I've seen happen in the last few years in education, because it really illustrates what we hope will be the first of many examples of this sort of thing. Kinney approached us and said, we have a need, as do all of our partners and competitors in the pharmacy business, for more pharmacy tech folks who are credentialed and prepared to come right in and get jobs that are going to pay very well and provide good benefits right here in the North Country. And in Governor in particular, the PRO-ACT arm of Kinney Drugs, our understanding is we'll have a degree of growth in the next few years that can provide some tremendous opportunities to North Country kids who are credentialed. So what we are embarking on in the fall, and again, it's all based upon subscriptions, and right now in our 3 centers, the number of students who've signed up to attend is a little more robust in one center than in the other 2. We would love very much to be able to run this in all 3 centers, so as a bit of a commercial out here, if you know of a youngster out there who might be interested in this, ask them to talk to their guidance counselor or their school official about whether that might be a good program for them. But it's a program literally that we're doing in partnership with Kinney Drugs. Their curriculum is already in place. We're not having to start at the ground level, and there are going to be students able to leave high school and get jobs right away. That, I think, is a model for what we could look at moving forward in a variety of other areas, in healthcare and in other fields. Want to touch very briefly on the kinds of opportunities that students in these CTE programs have. Articulation agreements and dual enrollment programs. 15 of our programs have articulation agreements with a total of 30 colleges and post-secondary technical schools, meaning in 15 of those programs, students who are successful in completing their program and meet the level of expectation that's been set by these institutions of higher learning, when they complete our program successfully, if they apply to that school, they will automatically receive a certain number of college credits right there that they won't have to pay for, that they've already got in the bank. Now, they've got to attend that school based upon what the articulation agreement says to get that credit. They can't just, upon graduation, carry that to any school. That's what a dual enrollment program is. And right now, 6 of our programs, we have dual enrollment arrangements with North Country Community College, meaning students are earning credits because those instructors are recognized as adjunct instructors from North Country Community College. The students are gathering credits, and they are taking them with them wherever they go to school afterwards. So in all of these cases, students are leaving not only college and career ready, but with a head start on college. Last thing I want to very quickly touch upon from about a 30,000-foot level is the multiple pathways concept. And again, we're dependent upon that conversation taking place at the Board of Regents level and State Education Department implementing it. What it essentially says is, right now, as I'm sure you all know, when a student graduates from high school with a Regents diploma, they must have successfully passed 5 Regents exams, the same 5 Regents exams. It's the same pathway for everybody. And what the multiple pathways concept speaks to is the fact that we have students of different shapes and sizes and interests, and that if we give them multiple ways to successfully get from point A to point B, that's in everybody's best interest. So instead of one pathway, perhaps there would be a fine arts pathway. Perhaps there would be a science, technology, engineering, mathematics pathway, or a career and technical ed pathway, where one of those assessments that currently is required of the 5 might be substituted, or a CTE assessment or a fine arts assessment or a STEM assessment might substitute. So this is something that's at the conceptual level, but we have high hopes for it. Uncertain whether it is indeed going to make it through the political waters of Albany, but we're hopeful, and it'll provide our kids with, we believe, more opportunities. So thank you, and again, if you'd like to discuss any of these in greater detail, I'd love to have that opportunity to talk with you. Thanks.
I must say that if you have a chance to visit any of the 3 technical centers here in St. Lawrence County, you should do so. It's amazing. Those are some of the happiest and some of the most productive schools you'll ever meet. You might wonder why in the world we're having a hospital guy come and talk to us about education. It's a pleasure always to welcome back David Acker, the President and CEO of Canton Potsdam Hospital, and he'll tell you why.
You know, I think all you have to do is read the newspapers over the last 3 years, and you know why. The headlines every week, consistently, are either about hospitals or they're about schools. And the news is running on parallel tracks. It's very, very similar. And so in education, what we see is the New York State funds are diminishing. Programs are limited. Staff are being laid off. Class sizes grow while teacher numbers shrink. And rainy day funds that are there to support these schools are evaporating to support budget shortfalls. In healthcare, the nation's drive to healthcare reform, at its most basic, means that we're going to be doing much, much more with much, much less. Cut after cut. Sequestration comes. Another one's undoubtedly coming, much stronger and more virulent than before. And program by program, things get cut. Workers get laid off. Programs are eliminated. Operating losses in the local newspapers of staggering proportions. They're not sustainable. So Monday's headlines have become the schools, Tuesdays are the hospitals. They're the same stories, just different terminology. Fewer teachers on Monday, less nurses the next day. Today's music programs that are gone are tomorrow's prenatal clinics that have gone. Several weeks ago, I went to a public forum at the Potsdam Central School. And as I watched the superintendent's presentation, my immediate reaction was, Pat Brady stole my PowerPoint. It was exactly the same. And the causes of the problems and the path that both schools and hospitals are on are very, very similar, and they're interrelated. So while the parallels are interesting, their true relevance is in how they're connected, not only to each other, but to the larger future of this region on virtually every societal level. Let's look at some of the basic realities that we're confronting. Employment. The continuation and the creation of jobs is the oxygen of all communities. Stable employment is critical, and large, stable employers are the most critical. Without them, there's no tax base, there's no decent services, there is no infrastructure that's supportable, there's simply a wasteland of poverty. And while there's many fine businesses in this county, the pulse of the center of the North Country is in 4 colleges. No business, particularly the colleges, can recruit and retain students and faculty without good health care. The most important question asked by parents taking their child to a college about the community is, how is the local hospital? And superb must be the answer. No hospital can recruit good doctors, the foundation of the delivery of health care, without high-quality public schools. And the most important question asked by doctors and their spouses is, what is the quality of the public education system? And superb has to be the answer. So if the schools begin to slide, and the hospitals will begin to follow that same slope, and then the colleges will be right behind. And this is not some remote vision of some distant, far-off future. This is now. We're just beginning to enter an age of government austerity. In healthcare and in education, the nation is asking legitimate questions. As we spend more money on healthcare, and our comparison to other countries keeps getting more and more dismal, and as we spend more money on education, and the results that we're getting from that education are so diminished to the relationship of that expenditure. The country is sitting back and asking of healthcare and education, what are we getting for all this money? Why do we want to spend more on it? Why don't we fix the systems before we continue to throw money at it? And it's a very legitimate societal debate that we're having. And I don't believe that until that debate is resolved, that we're going to see anything but continued cuts. The faucet is not likely to reopen in the near term. So we have what we have. And as you've noticed in education, we see as well in healthcare. Advocacy has less and less effect. There's too many industries, there's too many corners calling crisis, there's too many immediate demands on people. And the political system is too corroded by money to allow for our voices to be heard. This is just, the other thing is, I don't believe anybody's going to ride to the rescue. There's well-intended people in Albany and Washington, but they don't have the answers, they don't have the money, and they don't have the knowledge to really craft good solutions that work for us here. Those have to be done by us, using a different approach. For example, I sat at the school meeting in Potsdam, and I looked at the PowerPoint that Pat Brady put up on the screen. And as I looked at it, my takeaway, my conclusion is the heart of the problem is not a lack of state funding. The heart of the problem is the uncontrolled healthcare spending that is blowing up his budget, whether it's for current employees or retirees. And the hospital is the face of that problem. And if we stay on that path, where our hospital's goal is to get more of the school's money, we will sink them, which will sink us, which will sink others. We cannot be part of the problem. We have to be part of that solution. And this is just one fraction of one section of a broader issue. But what it illustrates is the interrelatedness of our current state, and more importantly, that the solution involves the school and its employees and the healthcare providers changing the paradigm. As we go forward, looking to each other to create the architecture of our future, a few suggested guiding principles might be worth considering as a starting point. Number one, we're not victims, waiting powerlessly for the next release of bad news from above. We're leaders. It's our job to act. Two, we're not prisoners to the paradigms of the old, to parochial pride, to benefit structures that fund past promises, divorced from present economic realities. We can't afford love affairs with buildings where we were born in or went to school at. And we can't adhere to shop-worn mantras like, charities should never pay taxes. It needs rethought. 3, silos are barriers to change. And the more we think of ourselves as working in a single silo or a discipline, it impairs our ability to do that which needs to be done. They create voids of knowledge. They disconnect us from one another at a time when we need so much to be connected. 4, one of our most vital roles is as educators to each other, as public communicators, and as listeners. And 5, our biggest problem is not money, it's time. There must be a sense of urgency about tackling the problem. So, where does all this lead? while the challenges confronting the public education and healthcare systems are large, at some point, you feel this corresponding sort of emerging renaissance here. It's in the topics that Steve Knight talked about. It's in about clean energy. It's in about the very, very strong pulse of creative arts, the environmental sensibilities that are just stronger and stronger in this community. We have a chance to be a really, really exceptional place. And that emphasis on the local sustainable agriculture, the commitment to preserving the environment, they're so invigorating. And it's as if we're at a tipping point where things could go really, really well for us or not. If we can not only stabilize, but reinvent this county's public education and healthcare systems, that renaissance could take full flight. This is our home. This is our time. Let's get about it. Let's seize a moment. Thank you.
Wow. I hardly know what to do when asking for questions, right? If there are people in the group that would like to ask a question of any of these three folks, this is a good time to do so. We have just a few minutes. There's mics over there. Raise your hand, yell out, whatever, right? And tell us who you are. Is that on? There we go. That's fine.
Hello. Hi, my name is Raylani Prudhomme, and I represent the Occupational Health Clinical Center in Canton. I have a question for Steve and Todd, is that correct? When you were discussing how you came up with the kind of the Common Core curriculum, that it was kind of a back mapping from where we see as the needs for where we need high school students to be in terms of whether they're going to enter higher academics or go into the workforce. And my question to you is there somebody doing an analysis in the North Country that kind of bridges our transformation in terms of how do we envision being, cleaner, greener, more sustainable, and what those high school students will need, 15 years from now as they are preparing to enter a totally different kind of workforce. I guess that's what I'm thinking, that the two can work in concert, because if we just look at the workforce today, that's not what it's going to be like by the time, kids who are just entering school graduate.
Sure. I mean, first, the back mapping that I spoke of with regard to where we need to be and working it backward was really done by the national scholars and experts who have been the authors of the Common Core, people like David Coleman and others. We, like all of the educators in the 45 states that are implementing the Common Core, are working as best we can to try and implement it on a very short time frame. I think your point is a very good one about making sure that it's not a static type of implementation, but that it becomes a dynamic process where we're always looking forward and saying, well, I mean, the bottom line is we're never going to be done. It's not something that we'll be able to point to some end point in time on a timeline and say, there we go, we've implemented the curriculum that our kids need and always will need. It is going to be a dynamic process moving forward. One of the processes that's parallel to the Common Core in the Regents Reform Agenda is data-driven instruction. And at the same time that all of our districts and the districts all over the state are implementing systems for curricular implementation and curriculum renewal, they're also implementing data-driven instruction systems where they'll be analyzing, not in some static way, how the kids did and then like an autopsy saying, well, they either did well or they didn't do well, there we go. But on an ongoing basis with formative assessments, with through assessments in the middle of the course, more like a checkup at the doctor's office, if you will, to be constantly adjusting their curricular interventions and moving forward in a way that is going to meet kids' needs. So I think you're right, it needs to be dynamic rather than static, and I don't know, I hope that answered your question.
Well, I was wondering if there's some body, maybe it's in the ANCA or, one of those committees, like the Priority Project Committee. I don't know all the structure of it, but is anybody, working with the educators to bridge that and, and be a voice in that dynamic?
No, overarching committee or structure exists that I'm aware of that looks at all of those aspects of it, but certainly we are engaging in a variety of partnerships with organizations like NAHAC to look at the needs in the health education area. We certainly welcome partnerships with private sector partners like Kinney Drugs, certainly public sector partners, and a variety of other partners that if we haven't got a relationship explicitly forged, I think those are the sorts of partnerships that will allow us to keep a finger on the pulse. Not aware of any overarching entity that oversees that, though certainly that might not be a bad thing.
So, Relani, thank you very much for volunteering to be able to be the person to operate that new committee. That's great. Are there other questions that people have in the last couple of minutes? Yes, sir, go ahead.
You can probably hear me from here. I'm Robin McClellan. I'm an adjunct at SUNY Canton and know nothing about education, which has been to some extent a benefit. And when I think about when I was in high school, there weren't very many MBAs. Most of the corporate leadership came in with BAs, and they were taught critical thinking. And I also know that when I was graduating from high school, I probably needed to know about a tenth of what a graduating high schooler needs to know today to function in the world. And I think that the challenge in meeting this real quantum leap in what people need to know is a quantum leap in how we deliver education. And it seems to me we have to somehow take some revolutionary steps. We cannot afford to have a limited human resources of teachers be doing repetitive teaching. We can't afford that anymore. We need to use the technology that we have. And I wonder, as I said, I know nothing about what's going on, and I really appreciate these presentations, which have left me with far more questions than you would be willing to listen to in the next hour and a half. But how does that work? Tom, I know this is something that you've worked with a lot. Can you speak to that at all?
Yeah, I mean, stick around for the afternoon panel, I guess would be the first thing I would say, but the second thing is, we're constantly looking at other states, other countries, and, back to what David said, we can't change the resources. So I think that really leads us to look at restructuring. And, there's always this, I guess, assumption that the way we're doing it in New York State is the best. And again, David, challenged us to ask a lot of questions, and that's what we're currently doing. We'll talk a little bit more about that this afternoon. But I think your point is well taken. How do we restructure in a way where we can bring the human capacity, right, to bear more directly on students in a more effective way? David used another phrase I like, silos. And if nothing else changes and the resources don't change, we have 18 school districts that can't afford to become silos. And actually, we have a long history in this region of our districts working well together. I mean, Steve put the stat up there, about 44% of our kids attending CTE. So we're already sharing a lot and regionalizing, but we're going to have to do more of it.
Great, thank you. Yeah, I think that's one of the points that I would add to what Tom said, is that when you think about what David Acker has just told us, there's issues both with health care and also with education, both of which are siloed. And that's worth serious consideration and, for that matter, rapid consideration. One more question? Go ahead, Judy.
My name is Judy Eldritch. I work for Addie Russell, but I'm wearing my own hat at the moment. one of the things that I struggled with as a parent when my children went through school was I had one that was really bright, and I had one that was really creative, and I had one that had a learning disability. And you talk about the cost for special education and that type of thing. I think we've gotten much better at defining what those special education needs are, which has driven the cost. But when I look at, you have to have 5 New York State Regents assessments to get a diploma. I look at my youngest one, who was learning disabled, and when he was first diagnosed, I was told, don't expect him to get out of a self-contained classroom, don't expect him to be BOCES material, and don't expect him to graduate from high school. But because I don't do silo thinking, even though I was a dairy farmer for 30 years, I saw something different in my son. And so I really had to push through a system that was not designed to assess